Welcome to the BDA Takeaway. We're entering week 6 of the COVID-19 stay-at-home order. So how is our healthcare system holding up? And what do they know that we need to know?
The trend is, at this point, I would say, we seem to be past the crisis stage of straining our system to the breaking point. The critical care unit, or CCU, that was where we felt the crunch most acutely, reached the point where we were on a status of what's called treat and transfer. That is to say, if a patient came into the emergency department needing critical care, we had to treat that patient immediately for any urgent needs and then look elsewhere outside of Overlake. We did have to do that in 2 instances that I'm aware of, and we were running at capacity for our staffing and bed capacity in the critical care unit for a period of time. We seem to be past that, and we have enough supplies, enough respiratory therapists, enough nurses and physicians, as well as bed capacity at this point. From the data that I've seen, we have done an exceptional job in the Seattle area and on the east side at social distancing, masking, PPE, personal protective equipment, and following the guidelines, hand washing, etc., that has kept us safe. At Overlake, we have had very few healthcare providers who have tested positive. Many of those, I believe, were exposed outside of our facility. Our infection rate has been less than 1%, including the clinics for the hospital, slightly over 1%, but that is a great testimony to the steps that were taken and followed by everyone here. I think our morale is quite good here at Overlake. We have a mentality that's probably similar to soldiers who are called into battle. This is what we were trained for, this is what we do, and we are proud to do it. We have felt that there's been a great swell of support from the community that has been very much appreciated. Donations of supplies, food, cards that have been sent, giving support, and that also has very much boosted morale here. From our standpoint, also continuing to follow social distancing and doing those things that have been recommended eases our workload. So that's also something that can be done by the community that shows support and helps us in the long run. Thank you to the community for all you've done and your expressions of support for Overlake. For those of you who would like to donate, the Overlake website has a site that you can click on for donations, and that would be www.overlakehospital.org, and that will take you through the process of how you can donate, and we can recognize you for those donations.
This has been the BDA Takeaway. Thank you to our supporters, Heritage Bank, Kaiser Permanente, Puget Sound Energy, and Vulcan Real Estate. The Takeaway was produced by the BDA, aka Bellevue Downtown Association, a nonprofit membership organization committed to strengthening the economic and cultural vitality of downtown Bellevue. And with the Takeaway, share bits of information to help us tackle these trying times.